we are going to enhance childcare in our counties. When we think about childcare, we are talking of the services. The services that are given to young children, the documentary we saw, they are meant to provide opportunities for these children to develop positive relationships. Number two, we are looking at childcare to include also education. When these children are 4 and 5 years, they are in school, their education. And when we are looking at education, we are also thinking about their nutrition, their health, the nurturing environment, and their socialization. And then the question we need to ask ourselves, where is this childcare happening? They have offered their homes to look after these children. That is home-based childcare. Then we have center-based childcare, which is happening either in daycare centers, like the documentary said, in the nurseries, or in play groups. These are centers where you can wake up, take your baby there, and then you go out there to work. But the third option is work-based childcare centers. This is where, as employers, as a county government, you come up with a space where young mothers who are working within that county or within that organization where you are working, they come with their children, they place them in that center, they come and work. So this is work-based childcare center. So why does childcare matter? Why should we talk about childcare? Number one, it is because once we are able to provide spaces where these children are taken care of, we are empowering women economically. They will have space to go and look for jobs to do. They will be able to be productive out there and bring bread in the table. Number two, it provides children with opportunities for development. In terms of, from the documentary, it was said, the first 5 years of a child's development are critical because there is rapid brain development. Between 80 and 90% of the baby's brains develop within these 5 years. So providing quality child care where they have trained caregivers. I know NITA has come up with a training curriculum for the caregivers, where they are trained on how to look after these children to stimulate. Then we are helping these children to gain the foundational skills that they require to interact with others and even to develop their language and cognition. Number three, in terms of business, productivity, and economic growth, the employers who support childcare services, they will reduce employees' turnover and also absenteeism from their workplace. And finally, in terms of family welfare and safety, if we are not able to provide the formal childcare options, children might find themselves in unsafe spaces where they are looked upon by younger children, maybe who are not attending school, or they are accompanying their moms into their work sites that are not child-friendly. Now, when we talk about childcare, it is important because we are talking about tangible numbers. If we look at the population census of 2019, children between 0 and 5 years, we are talking about 7.2 million children. And out of these 7.2 million children, 2.5 are within the school setup between 4 and 5 years. And those children, they have teachers, they have trained teachers, they have a curriculum. But we have a huge 4.7 million children who are below 3 years, who should be at home with their moms or caregivers, maybe who are not qualified. That's why it's important we talk about childcare today here. Number two, when we look at the Kenya Demographic Health Survey, it tells us we improved in terms of children's health, moving from 26% to 18% in 2022. But if you look at that critically, you will realize that children who are stunted, 28% of them are coming from those from the lowest quintile in terms of wealth. 20% are coming from mothers who have no education. And then we are looking at another 20% of that 18 coming from rural areas. So if you look at that education of the mother, those from the low quintile, wealthy quintile, and then you are looking at those from rural, you will realize they need support from our counties in terms of providing childcare, where they can leave their children to go and look for bread for their children. That is in terms of brain development. As you can see from the first graph there, language development, sensory pathways in terms of vision, hearing happens rapidly in the first year, while higher cognition develops in the year subsequent. And then in terms of brain development, you can see the graph how it is moving from 25% to 90% in 5 years. Again, from the Kenya Demographic Health Survey, we also realize in terms of children who are developmentally on track, then we realize the children in rural are disadvantaged. Many of them are not developmentally on track. Those from the mothers with low education or no education, and those from the lowest quintile. Again, that is an indicator why we need to have childcare for these young children. So what is the status of financing childcare? In terms of public investment, we realize that it is low when we compare it with the international agencies' benchmarks, the International Labour Organizations, UNICEF, UNESCO, and all that. Internationally, we are supposed to have a government sparing 1% of the GDP to their early childhood education and care. But the global medium, when you look at it, spending on pre-primary education is around 0.4%. In terms of education budget, those of you who were in Tashkent, there was a declaration that all the education resources, 10% of that should be allocated to their pre-primary education. Is that what is happening? Of course not. So when we look at this from the lens of Kenya, we realize that Kenya invests less than 0.2% of its GDP on early childhood, but also approximately 2% of its educational resources on pre-primary education. From 2022, we did a study on ECD systems in Kenya. We were focusing on financing early childhood education, primary health care, and social protection. And one of the things we realized, as much as there is low allocation to primary education compared to technical, the funds that comes to the county, and even for social welfare, we realized that whatever little that is allocated, it is not all absorbed. Some of the reasons when we went to 7 counties trying to understand why, we were told, number one, it's not a must that what you have budgeted for is what is financed. So that's why you can see the difference. Number two, they said there is late disbursement of funds going to the counties. And because of that, there are activities that were planned to happen that are not happening. Reason number two. Number three, they said when it comes to supplementary, you realize that the easiest place to take funds from is from the kitty of early childhood education. So these are some of the things that are within the support that you can give as honorable members to be able to support. Then now we move to the barriers to financing childcare. What are some of the barriers that are preventing financing childcare? Those that are related to public sector and the policy barriers include low national prioritization. That means childcare or early childhood education is not prioritized. In terms of allocation is less than the internationally recommended 1% of GDP. Childcare is rarely a standalone line in the national budgets, and this one we were able to see it because when we were looking at social welfare in our study, we couldn't find a budget line specifically for childcare. So that is also a barrier. And then there is a disconnect between the national government, which holds financial resources, and the subnational, that is the county level. But also we noted that funds are diverted to high visibility programs like political capital, infrastructure, bursaries, and things like that. In terms of data and transparency, there is inconsistency on data collection and lack of disaggregated reporting, which makes it difficult for you as policymakers to establish a baseline or identify the existing gaps. And finally, on private providers and market barriers, there are those, like I said, there are those moms who have now started their own centers to be able to provide these services. These providers face a lot of challenges, and because they require to feed these children well, like we saw in the documentary, they require to ensure that children have stimulating materials. They are not able to do that. Another challenge that that has been identified is registration and high licensing fees, which prevents new providers from entering into this area, and which sometimes makes them even hide wherever they are providing. So by the end of the day, as a county, you are not able to say, how many child care providers do we have? Where are they providing? Who is providing this care? And then the providers heavily relies payments from their parents, and if the parents are economically hit, definitely it becomes difficult for them to survive. I now want to move to what are some of the recommendations that, that we need to look at. Number one is to establish dedicated and a ring-fenced budget allocation for childcare. Having a line, like when we were doing our research, you go to the county, we were using the budget implementation review reports. You go to that document, you will see either ECD or a pre-primary education, it is there. But childcare is not there. So we are saying, can we establish dedicated and ring-fenced budget allocation for childcare by creating budget lines for childcare and ECD, by protecting these funds from reallocation during supplementary budgets, and by progressively increasing allocation towards international benchmarks of 1% GDP and 10%. Number two, in terms of legislation, there's need to legislate county child care laws and the policy frameworks. Enacting Child Care Acts on financing. I know we have Child Care Facilities Act in a number of counties, but we are looking for that Child Care Act that talks about financing child care. Then we need to define child care as a public good and an essential service. If we were to look at it from there, from that perspective, then I think we will all be able to focus on this, and then we need to establish standards and accountability mechanisms. If you allocated, for example, 10 million for childcare, how was it used, where, and by who? You know, accountability mechanisms if we have that framework. Number three is to introduce subsidies and financing mechanisms for households. We talked of the low quintile households. We talked of mothers with no education. We talked of rural areas. How do we support them? Can we come up with subsidies that identify these vulnerable groups and support them with childcare? And finally, is to integrate childcare into county and infrastructure development, having it stand out in the county integrated development plans, in the annual development plans, requiring childcare facilities in markets. I know Tarakaniti County was the very first county government to come up with a crèche in their Chuka market to support mothers, and I know they have gone a step higher to come up with childcare within public schools, and then finally ensure services on childcare reaches where it is most important. Thank you, and I want to believe that all of us, as we leave this 6th assembly, it's going to be an assembly of the difference, where we have all of you as our champions for childcare in your counties, that you are going to come up with budget lines that are going to speak to childcare, and that you are going to make mothers who have been hiding doing childcare in their places to come out and ask you, now I hear you are charging 200 for a license, I want my license. That is how we will know our children are safe, they are under safe hands, and may God bless each one of us.
Thank you, Prof. Thank you for that introduction and an overview of childcare. I believe by now everyone understands what we are talking about. So, in order for us to just confirm what our professor has told us, I've brought in a caregiver to just, as evidence, as validation of what we are talking about. So kindly allow me, before I call my panel, to call my provider, Ms. Teresia Obura, who has 10 years experience in handling children in her day-to-day. That is a source of livelihood. She's based in Mombasa. Na ningependa atuambie ni changamoto gani anapitia. Madam Teresia, tafadhali. So let's welcome her as she comes.
Hamjambo wapendwa. I will not take much of your time. Nitaongea kwa kifupi sana. Kwa majina naitwa Teresia Obura. Okay. Majina naitwa Teresia Obura. I'm a director of Help Nursery. My center has been operating for 10 years. And my passion is to oversee daily operation and curriculum development for children. And I'm so glad and thankful that Kidogo has given me this platform so that I can give out the best service. My daycare to give out the best service. And the changamoto we are getting kwa ground is about licensing. License iko very high, whereby even the parents themselves hawatupati pesa on time. Unapata mtu anapata pesa mwingine tarehe 1, mwingine tarehe 2, mwingine tarehe 10. So gathering those money together inakuwa hard, and whereby we have a lot of responsibilities, like you need to pay water, you need to pay electricity, there is food there, and there are some facilities which need to be taken care of. Inakuwa ngumu. And if we go to the government, to the county government to pay, like kama January, unaambiwa bado kuna shida na ile mtandao ina matatizo, you can't pay on time. So I go back with the money, whereby I start using the money. Na inakuwa shida. And when we open, things will be tough. There is that harassment too, whereby they don't want to know why you have not paid. Hakuna ile patience ama maelewano vizuri. And some of us are even operating while hiding. Some of us run away and leave those kids alone just because of the fear of being caught up with the law, that they're operating illegally. So it becomes very tough. We need the government to assist us, to help, so that we can create a very safe place for those kids. I don't have much, but we'll talk about it later.
Asante Teresia. Thank you so much. So makofi kwa Teresia. She's one of the champions on the ground who takes care of our children as mothers as we go to work. So honorable members, as we've heard from the introduction, we realize that our childcare services remain largely informal, underfunded, and weakly regulated. So the session therefore explores how county assemblies can prioritize and strengthen public investment in childcare as a strategic driver of social and economic development. So to the honorable members, my key questions as we have this conversation is what legislative and policy gaps hinder effective public financing and regulation of childcare at the county level? And also, how can county assemblies leverage their budgeting, representation, and oversight roles to prioritize and expand access to quality childcare services? So at this point, allow me to introduce my panel. I have CPA Mary Wanyonyi Chebukati. She's the chairperson of Commission on Revenue Allocation. CPA Mary Wanyonyi Chebukati is a highly accomplished certified public accountant, certified professional mediator, and financial analyst with over 37 years of distinguished service in public sector, both at national and sub-county levels. She's a diligent and results-driven professional with extensive expertise in government operations, public financial management, and implementation. CPA Mary has also provided strategic leadership through her service on the boards like Kenyatta National Hospital, Masai Mara University, and Cooperative University of Kenya. In addition, she served as chairperson of the Kenya Ladies Golf Union, demonstrating her commitment to leadership and excellence in diverse sector. She's a member of the Institute of Certified Public Accountants of Kenya, ISPAC, the Institute of Certified Investment and Financial Analysts, and the Association of Women Accountants of Kenya, AWAC. She holds a Master of Business Administration and a Bachelor of Commerce Accounting. Help me welcome our chairperson on the Commission of Revenue Allocation, CPA Mary Wanyonyi. Karibu sana. Makofi hayatoshi jamani, tumkaribishe. Si tunataka pesa? Haya basi, tumpigie makofi. As she takes the stage, allow me to introduce CPA Karen Agengo. She's the Principal Secretary, State Department for Children's Services. CPA Karen Agengo serves under the Ministry of Gender, Culture, and Children's Services. Appointed in April 2025, she brings extensive expertise in public service, finance, and tax administration to advancing child rights and welfare in Kenya. She previously served as the Kenya Revenue Authority in strategic roles spanning tax enforcement, real estate taxation, and dispute resolution, and contributed to international revenue policy reforms in Somalia, Somaliland, and Burundi through World Bank-supported initiatives. CPA Karen holds a bachelor's degree in education, accounting, and mathematics from the University of Nairobi, and an MBA in finance from Moi University. She's a member of ISPAC and ISACA. Passionate about public service and child protection, she leverages her financial and governance acumen to shape policies that secure a brighter future for children. Naomba tumpigie makofi PS wetu, PS Karen Agengo, as she takes the stage. Welcome, PS Karen. Okay. Allow me to also welcome Dr. Margaret Nyakango. She's the Controller of Budget. Makofi jamani. Okay. Tunataka pesa na power. Okay, Dr. Margaret Nyakango was appointed the Controller of Budget in the Republic of Kenya on 4th December 2019 to oversee and report on the implementation of budgets of national and county governments to the National Assembly, the Senate and county assemblies, and the executive every quarter. She holds a doctorate in business administration from the University of Liverpool, UK. She also has a Master of Business Administration degree in strategic management. Dr. Nyakango is a practicing member. Jamani, ni budget. Naomba tusikize basi, tusikize bio yake. She's also a member, Dr. Nyakango is a practicing member and fellow of the Institute of Certified Public Accountants of Kenya. She's also a member of Association of Women Accountants in Kenya and active member of Women in Boards Network with hands-on corporate experience. Dr. Nyakango has over 30 years experience in finance, accounting, strategic management, auditing, tax, human resource, and governance, all gained from working in Kenya's public and private sector. Dr. Nyakango received the Chief of Order of the Burning Spear commendation awarded by His Excellency President of the Republic of Kenya for her distinguished role in national development. Makofi kwake jamani. Okay, so for this conversation, tulisema we needed also to have a member from intergovernmental relations and technical committee. See, we know functions were devolved. Zengine zikabaki national, zengine zikabaki county. So allow me to welcome Commissioner John Kimwela, who is a member of Intergovernmental Relations Technical Committee. He's a seasoned practitioner in devolution and decentralized governance with over 15 years of experience spanning public administration, policy development, and institutional capacity. John's professional background also includes experience in the media and financial services industry. He has worked as a media consultant leading to firms such as Capital FM, Standard Media, and Nation Group. He has provided strategic guidance and technical support to national and county governments, contributing to the effective implementations of Kenya's devolution agenda. Makofi kwa Commissioner John Kimwela. And last but not least, we can't have this last but not least, we can't have this conversation without having one of our own. Nilitafuta member wa budget committee. Honorable Graham Kagali is the chairperson of Budget and Accounts Committee at Migori County Assembly. He's a finance professional and a public servant currently serving as a member of a county assembly for South Kanyamkago Ward in Oriri constituency. He holds a Bachelor of Business Administration, Finance and Accounting, a diploma in accountancy with CPA training. He has extensive experience in accounting, having worked for British American Tobacco, Sony Sugar, and Alliance One Tobacco Company before moving into private practice. Mr. Angogo was first elected as MCA in 2017, where he served as the Vice Chair of the Budget and Appropriations Committee and later Chair of the Finance Committee. He was re-elected in 2022 and currently serves as Chair of Budget and Appropriations Committee, leading to oversight on county budgeting and financial management. Makofi kwake. So we are going to start our plenary session, and I need your active participation. Thank you. One, two, okay. Okay, thank you so much, and we're going to proceed with our session. And I'll go to CPA Mary Wanyonyi, our Commission on Revenue Allocation. Under the 4th schedule of the Constitution, childcare facilities are a devolved function. However, they're often underfunded because they fall into a blind spot, especially between health, education, and social services, because of their multi-sectoral nature. So how is the CRA accounting for the unseen population of children under 3 when determining county allocations, given the official enrollment data usually captures the pre-primary 1 and 2? And also, what is the CRA's recommendation to ensure that counties ring-fence funds, specifically for childcare?
Thank you very much, Chair. And thank you to the organizers for having me at this forum. Thank you for that question. It is an important question. The principal mandate for the Commission on Revenue Allocation is to recommend resources between the sharing of revenue resources between the 2 levels of government and amongst county governments. Now, you have mentioned the PP1 and PP2. So the Commission on Revenue Allocation does not specifically recommend funding for the sector specific. In this case, when you talk of the PP1s and the PP2s, those are sector specific. We recommend funds, and they are shared out based on a revenue basis. Currently, the revenue basis of sharing is what we are now referring to as the fourth basis for revenue sharing. Now, the PP1s and PP2s fall under the population, and when we allocate resources, one of the parameters that we use, we have various parameters, but the key parameter we have is population, which is at 45% of the entire recommendation that we make. Now, those young people fall under the population. They are counted within the population numbers. But, however, they are not specifically addressed. And as I said, we don't recommend sector specific. We only recommend, through the population parameter, we allocate funds to the counties. It is up to the counties to prioritize these funds and ensure that childcare is anchored in law so that they are able to plan for the childcare. They are able to provide for childcare in their budgets, and through the oversight role, the assemblies are able to follow through and ensure that whatever funds have been allocated have actually been utilized for childcare. So it's all about visibility. Is childcare visible for it to be funded? And what is seen and what is prioritized gets funded. So once it is funded, it gets resources for purposes of implementation. So the county assembly, through their oversight role, must ensure that it's not also a matter of expenditure of the childcare. As I have heard our caregiver here say, they are not catered for. And that is because of the multi-sectoral. You talked of a blind spot. Yes, childcare sits in a blind spot because you will find it in the health, just the way it had been mentioned by Professor. You'll find it being looked at as nutrition. You'll find it being catered for under the social sector. But it needs to be identified and prioritized and made visible. So when that happens, then the county assemblies are able to also ensure that it's not only an expenditure that incurs once it is in the budgets, it is also, they should also follow up on issues of impact. So that is what I can say for now. Thank you very much.
Setting standards and coordinating child protection services, what measures is the State Department putting in place to guide and support county assemblies in formalizing, regulating, and scaling up quality childcare services? Thank you.
Thank you very much for that important question. I just want to highlight, as our commissioner has talked about the gaps. The ministry has noted the gap on financing for childcare, and for that reason, the ministry has developed the National Care Policy, which provides for now taking childcare matters to a higher level. And because we believe that childcare requires both the levels of government, the national and the county government, to play a role. in ensuring childcare is well taken care of. So in the national care policy, we have childcare, and now we are working with the counties to ensure they develop also county-specific policies that will provide for childcare. And once the policies are developed, then we can have now childcare budgeting put up under the county budget. We know that this cannot be left alone for the counties, and so the State Department for Children is also working with counties to develop the child protection policies. We have supported a number of counties. However, not all our counties have the child protection policy. With this, we'll be able to ensure child care is taken care of. In addition, we, through the COG, the COG, we have brought on board representatives from the counties to discuss the integrated early childhood policy. And this is an advanced level to the cabinet for us to recognize that early childhood is very critical, and once this policy is approved, again, we will roll it down to the counties to assist them develop county-specific ICD policy. With all these policies, we will be able then to integrate childcare in the county budgeting. Thank you.
Madam PS, and allow me to have a follow-up question. Do we have a timeline about the ICD policy that we are looking at?
We are looking into, in a few months' time, the cabinet should be able to approve the ICD policy, I believe in 2 months, for us to be able to roll it to the counties and assist our counties to develop the ICD policy, which is counties specific.
Thank you so much. That's very clear. So we are looking at, by the time we are starting financial year 2026, 2027, we should be having it rolling down. Thank you so much. So to the Controller of Budget, Dr. Margaret Nyakango. Okay, so in Kenya, the COB plays a critical oversight role in ensuring that public funds at both the national and county levels are spent exactly as the law intended. So many budgets bundle childcare under either social services, education, or health. So is it possible for the office, for your office, to provide maybe a specific breakdown of funds authorized for childcare services versus ECD? And if not, maybe how best can we move forward to ensure that there's maybe targeted funding? And also, within the mandate of approving withdrawals and reporting on budget implementation, how can your office strengthen its oversight to track, report, and enforce accountability on county spending, specifically for this conversation allocated to childcare? Thank you.
Thank you very much, moderator. And thank you, my listeners, and a few of those who are not listening. I think we need to hear this. Okay? We need to hear this. Now, from previous presentations, I listened to the professor who was here, and we had the benefits of having a good background for our children. So that cannot be gainsaid. Secondly, we have heard from the two other panelists before me who have confessed that so far we do not have legislation that governs children of the ages 0 to 5. So what that means is that my office does not come in. I'm sure that is now obvious, that certain things need to take place before my office comes in. So what does my office do? And most of the people in this room know what my office does. I approve withdrawals based on budgets. These budgets are derived from planning documents. So at the county level, we are saying that we must have proper planning documents if we are going to have the approvals made. So what has been happening is that because there is no legislation, many counties have perhaps created a sub-program, but which is not unique to the children that we are talking about of the ages between 0 and 5. So you will find that the county fiscal strategy paper does not have something to do with children, but maybe something to do with the early childhood education. I know that some counties have taken the initiative to try and start feeding their children. I know that Muranga is giving their children some porridge, that Kisii County is giving children some milk. But again, this is just random. These are just personal initiatives. So what can my office do? If the legislation is in place, I will ensure that the approvals for these funds are done in good time. Additionally, I can monitor the expenditure and report on it quarterly, as I do with the rest of the budget. And after that, I can also do monitoring and evaluation in terms of ascertaining the benefits that we are getting from the expenditure that we'll have made on child care. So here we can see that a lot of the entities at the county level are involved, but mostly because we have the county assemblies here today and many other decision makers, including the PS here. We need to formulate the legislation, and the PS has said that has already started. Then the executives, with the help of the county assemblies, will incorporate this in their budgets. Then I will come in and do the rest. I think we are good. Thank you.
Thank you so much for clarity. So we appreciate, at least that is clear. And sasa PS wewe ndio tumekutegemea. Because once we have the legislation in place, it's easy to follow through for the financing. And allow me to go to Commissioner John Kimwela from IGRTC. So we say, since childcare is a devolved function under the 4th schedule of the Constitution, the IGRTC is the primary body to address the friction between national policy and county implementation. We say resources follow functions. So following the Delineation Gazette Notice 16483 of December 2024, what is the implementation status with regards to childcare facilities, and are these integrated even into the upcoming 2026-2027 County Division of Revenue Share? Maybe, but maybe you already have an answer. And what is IGRTC doing to resolve the overlap between the national government's role on specific functions, e.g. child protection, for example, and the county government's mandate to establish, regulate, and budget for childcare facilities? To you, Commissioner.
Thank you. Good morning, everyone. So, one of the responsibility of IGRTC was the transfer of functions, devolved functions. And so, that brings me to the question of child care. And child care is the age between 0 to 18. However, under Schedule 4, age 4 to 5 is taken care, but 0 to 3 is not taken care of. And as per the law, that is the residual, that means 0 to 3 is a residual function, which technically now goes to the national government. And that is the reason why it's not under the county government. However, in the spirit of collaboration and the principle of subsidiarity, when looking at activities such as what the county government is collaborating with the national government in putting up the markets, and the presenter mentioned on it, that there's a provision for space for childcare in these markets. And so that means within the market, which is a function of the county government, there is a function of the national government. And so that is how I say now the principle of subsidiarity, childcare is closer to the county government. So they can have an agreement between the two levels of government, an IPA signed, and of course with the advice of the AG, then the function can be carried out by the other level of government. And the issue of the IPA, I know COB is very strict with it. If it's not signed, she will not take it. Thank you. I think your next question is on the overlap. And I mentioned about, with the new constitution, we were involved in unbundling and delineation of the functions. And that is what, now that means we gave each level the functions that belong to them. So far, we are done with the county government, and of course, later on, we'll move to the national government. And that should be able to help. But of course, after the gazettement of these functions, there are some challenges that we also noticed, and these are the areas we'll still address. Number two, we also have the ADR mechanism to resolve any issues that arise between the two levels of government, especially on functions. And that is one of also of the functions of IGRTC. So whenever there's an issue between the two levels of government, it can always be raised with IGRTC, and you should be able to handle that. And finally, we'll also be doing assessment of the devolved functions as IGRTC, so that we also address, we're able to ascertain the gaps and address the gaps that exist. Thank you.
Thank you so much, Commissioner. Thank you for the feedback, and we are looking forward. Umesema your document yenye control of budget needs to sign inaitwaje? That it has to be signed before it goes to the COB.
Of course, you remember that issue on education, and she was very strict about it. So that is the IPA.
In full?
Inter-parties agreement.
Inter-parties agreement. Aya, tumesikia hiyo, it needs to be signed. So tumheshimiwa Graham Kagali, chairperson of the BSC Migori County Assembly. So you are representing the many of us seated in here today, and I'd like you to just advise us. Like across many wards, we know that childcare providers operate informally due to complex licensing, as our own Teresia has mentioned. So what steps can the county assemblies take to create a simple, affordable licensing framework that enables providers to register and access support? And also, we'd love to know, how can childcare find its way into the 2027 manifestos as you go to campaign, and consequently the upcoming CIDPs? To you, Mheshimiwa.
Thank you so much, Madam CPA. I want to really thank you for those two very wide questions. And allow me, before I contribute towards the questions, one, I want to highlight to the members seated here and my fellow panelists that childcare is a very, very important aspect, not only just to us as parents, but also to the human resource, or the future human resource of this government. And the Constitution is very clear, and it is very protective about the child issue, especially Chapter 4, that actually encompasses everything. When you go to Chapter 4, there's Article 14, Article 15, Article 53, that is very elaborate. But I want to draw your attention to Article 21, Part 3 and Part 4 specifically. And Part 3 and 4 talks about the houses being able to do legislative or acts. These acts are supposed to protect the children. They're supposed to give guidance. And just to draw the attention of this House, the Child Act has really taken a long time. When we check at our records, the last time it was in place was 2001. And it has been followed by the 2022 one that came recently. You can see the gap, that is 21 years. So it is something that needs to be fast-tracked all the way to the county assemblies. Now, how do we do this? One, the county assemblies need to have a licensing or a registration by law to support now these functions. We have several committees that in respective counties, these committees that are in charge of children affairs. But unfortunately, they concentrate more on ECD learning. They do not concentrate on the build-up of this child before he gets to the ECD status. So the bylaws that are really missing in the counties need to be enacted fast. And CPA, Margaret has actually stated she has no problem releasing funds so long as there are channels or pathways to release this. One, county assemblies to formulate these bylaws. The other issue is to make sure that as county assemblies, we are able to include this talk about child care financing into our main activities through the committees, the respective committees. And you realize that the committees that we have at the assemblies, various assemblies, the Children's Committee might not be able to fully address the issues of child. We have the Health Committee, we have the Budget Committee, we have other Education Committee that needs to come together so that we can actually articulate issues as assemblies to enable finances follow the laws. We are also challenged on policy formulation as counties, but I believe there are counties that are a step ahead. The regulations and even the enactment of the same should actually be fast-tracked. This can only be done by the county assemblies. The same county assemblies should be able to protect the issues through even the respective ward offices. You realize that because of devolution, we have the ward administrators, we have the village administrators in some counties. All these are supposed to help in making sure that whatever comes up goes to the next level. The other issue about licensing of these homes, because we know the homes are there, but are they legally recognized? The answer is no. What are the challenges, the processes? Once these policies are there and the processes, and we have certain tiers, so that the small homes or the small caregivers have a certain minimum amount to pay. And these tiers will be able to accommodate each and everyone. But if we have just a one-off or one size fits all, some of these caregivers are unable to actually have these incorporated in, these caregivers are unable to do the registration because of the challenges and the expenditures involved. So we need to actually form the tiers so that we can have brackets accommodating everyone. Then finally, on how we can get into the manifestos, this can get into the manifestos. Actually, as we look for these votes, there's normally some liberal issues. You will talk about roads, you'll talk about health, you'll talk about water as your key priorities. But rarely do we talk about, I will support these children when I'm elected. So going forward, we have two options. One, if it fails to get into the individual manifestos, because some of the other developed, the first-class countries, you'll find that when someone wants a seat, like the president, you'll be asked, what do you want to do about drugs? What do you want to do about the children? What do you want to do about this? So all those must be incorporated in someone's manifesto to actually encompass everything. But unlike us in Kenya, we have manifestos that suit a particular issue because of the pressure that you have. So the only way is that once it skips the manifestos, every county government has a planning department. That is a must. The only leeway that we have as county governments is to have these planning departments incorporate this, especially as they start off the CIDPs, so that they can actually give guidance When we go for public participation to get this data, it is driven at the department level. And I think that one can easily be incorporated into the final issues. Thank you.
Thank you so much, Mheshimiwa. I think in Kenya we need to start the public debates ahead of somebody maybe looking for re-election. So I'd love to throw the session back to the audience. Do we have any questions? We can take 2 or 3 in the interest of time. Any question to any of our panelists before they give their final remarks? Someone to help me on the ground? Somebody to assist with the microphone? And also be specific on whom you'd love to hear a response from.
Thank you. Can I come first?
Okay, you can come first.
Yeah, thank you. I'm Honorable Waka. First, to just allow me to raise my questions, and they will go straight to Dr. Nyakango. Panelists, you love to pardon my style of questioning or raising the question, because first of all, I'm meeting Dr. Nyakango, and in my own imagination, I thought she was not a human being because of the way her office operates. And I've seen a very smiling, jovial lady. I thought you are not a human being. My first question, matters legislation ideally requires resource mobilization. And for you to achieve the kind of discussion we are having today, then the assemblies has to be facilitated fully, even to go through public participation before it becomes a law. I believe I'm right. And if you look at the way Daktari handles the assemblies, the county assemblies, Daktari, I'm asking you this question. Do you appreciate the role played by the assemblies, considering the culture of discrimination by your office to the assemblies? That's my first question. Because if we have to undertake this, then the assembly must have, your office must look at the assembly as also a body that is applying, supporting devolution. Now, number 2, do you also believe in delegation of duties? Since in your office, it is perceived that you are the only person assigning all the documents. And that is why, even when it comes to matters of receiving funds, it delays. And Daktari, at times some of our colleagues, even we die when you are still waiting for your signature. Do you really believe in delegation? Or you are the sole signatory of everything in your office? In third, the assembly can only offer, and I will go like this. We can only offer effective oversight when we are properly resourced. And Daktari, if you get anything that is supposed to be added to the assembly, you don't support. I'm asking, that is where I was actually coming from the word, are you really a human being? And if you are, do you really consider, because even in your own village, there are also MCAs. In your own village, there are also county assemblies. Do you only believe that you will only remain in the national?
Thank you, Mr. Waka.
No, just allow me to handle this kindly once. Kindly. Just allow me. Be patient with me.
Okay.
Kindly. Lastly, can we create, Daktari, and harmonize linkage between your good office and the assemblies, so that if we have an issue, we know where to come to? Because we've seen you called by the National Assembly, and you go there, handle them with dignity. That is not done to the County Assembly, because we don't oversight you. Or why do you handle us that way? I know I might not have pleased anyone, but that is me. I thank you for that.
Thank you, thank you. So we go to, on my further left, there was a question. Kindly, 1 minute.
Okay, thank you. My question goes to the chairperson, revenue allocation, though it's open to the panelists. And this, borrowing from the general responses that we received, 2 items that came up significantly is functions to the counties. So the transfer of functions versus resources allocated to those functions. Number 2, optimum survival level, or rather optimum running of a county government. We have in our records since devolution, counties that have been receiving less than 6 billion in allocation, while we have experts who can analyze how much it costs to run a county. There are functions that must exist. Even if you have 1 person per county, you must have a doctor, you must have an ECD, even if there are 2 people. So allocation versus numbers has been a disservice to this county, to this country. Now, I wanted to hear from the chairperson, what do you have as a comment and as a professional in finance matters? What is your comment to this? Because I come from a county called Taita Taveta. We receive less than 6 billion as revenue allocation. We have functions that must be serviced, including a payroll, which, per the policies, the payroll budget should run around 30%. But in the meanwhile, based on the minimum allocation you have, unless you do retrenchment of all the staff, you'll never achieve that payroll allocation. So I tend to feel somehow some counties were designed to fail. From the word go, we can never prioritize education when you do not have enough money to run. So what is your comment, general comment on this one? My name is Jimmy Mwamidi. I'm the budget committee chair for Taita Taveta County.
Thank you, Mheshimiwa. There's a hand over there. Kindly pass the mic, then we'll go to the panelists to respond to the questions.
Thank you so much. For the records, my name is Honorable Jojo Mamba, a member from Migori County. Of course, a senior member from Migori County. I have a question to the Office of the Revenue Allocation. The other day, I saw some letters written advising, I don't know whether it was advisory or it was a mandatory letter to curb certain payments done to the offices of the county assembly representatives. Is it an overarching mandate that letters must again come from your office, and of course aware of certain regulations of the management of the offices of the members of county assembly? I look at this as a way of killing devolution, because as much as you are guided, we are equally also guided by the budget. So I would ask whether your office is really in order to micromanage the offices of members of the county assembly, even though we are guided and within the financial regulations. Now, there are certain thematic areas that are left in the national government, and certain thematic areas, the same areas are also devolved. The issue at hand is the issue of children. In the absence of a working law, in the absence of the working law within the county, would we make the bylaws on the existing laws from the national government, or bylaws went with the local authorities, or we could customize the laws from the national government and govern the same departments that are devolved? Lastly, on public participation, I did hear my colleague say about the financing from the office of Madam Nyakango, CPA. In the absence of working public participation law, would the counties be allowed to find, because the counties are different in nature from county A to B and C and D up to the last one, would we be in order to be using the general law guiding? Because even the Constitution, in my view, is different. Because the Constitution says there shall be there shall be public participation. And then says Parliament shall regulate. So there, what is that public participation? Madam Nyakango, you know, sometimes, hata kama tunakupiga, you will get the devil advocate in me. Because what is public, what qualifies to be the membership of a public participation? Because I can take my wife, my daughter, my son, and my mother, my grandfather, I call that public participation. So I think I would urge the counties to also work on the laws that govern the public participation. Lastly, I have been a member of County Assembly from 2013. Madam CPA, some of the rules that we used to have then concerning the financing of the counties, sijui kama ni wewe, zimekashwa sana. Sione vile unafanya bana. You know, in 2013, there were a lot, you were not there, but the office was a bit relaxed. Lakini saa hii, hata chai ya kikombe, you are being told Nyakango will complain. So you are the one who has been complaining, Madam Nyakango. There are certain things, but you really need to funga macho, but be aware of the Public Finance Management Act. The Public Finance Management Act states clearly that there shall be prudency use of finances. Hapo Fenya, so that siku ingine tusipatikane tuko sell. Asanteni.
Okay, thank you, Honorable George. So allow me to get back to the panelists because we only have 10 minutes remaining. So I'll request Dr. Nyakango to start responding to Honorable Waka's question. And then we have an address to the CRA by Mheshimiwa Jimmy on Taita Taveta, the questions he raised. And then the issues about absence of a working law, I don't know whether Commissioner John, you are best placed to handle that. I know it was addressed to CRA, but I feel about the functions, you can give clarity. And then after the three respond, I'll ask our PS briefly to give a status update on, there was a New York session on public financing for childcare during the CSW 70 brief, and then I'll ask the remainder of the team to give closing remarks. So, Dr. Nyakango, 3 minutes, please. Thank you.
Thank you, moderator. And I'm very human. In fact, I'm more human than a lot of people I see around. Let me explain why I am very human. Now, matters legislation require resources. Absolutely, we all agree. But we also agree that resources are always scarce. That is the key word, and it should be in bold. Now, when resources are scarce, it means that they must be used where we can obtain maximum impact. Now, a lot of times, what we are calling human here is using resources for things that do not necessarily give us impact, but which please our pockets. Now, that's where we part ways. Do I appreciate the role given the discrimination? I was hoping that the honorable member would give an example, but he did not. What kind of discrimination? I do not know. But on this particular count, Honorable Kamanza must be somewhere here. Honorable Kamanza. What a pity. Because he knows what we have been doing together. And indeed, if there is anyone on this line here who has been with CAF more than anybody else, it is me. Secondly, I confirm in black and white that the MOU between CAF and the control of budget is duly signed and in operation. This is the reason I have been having to abandon other activities to ensure that I'm always present where CAF has an activity. Indeed, I was in Embu recently when we discussed the issue of women legislators. I am here today and I've abandoned my other duties to come and be with you as you deliberate on the very important issues of financing and childcare. So indeed, no one can beat me on this. Now, it is perceived that I'm the only person signing documents. Surely nothing can be wronger than this. Am I not sitting here? Do you think my office has stopped working because I'm sitting here? Honorable, is it worker? Do you think the Office of the Control of Budget is not working because I'm sitting here today? Can you please confirm? You can go outside, call the Office of the Control of Budget, ask them if anything is going on there, and you can come and tell the population that this is based on malice. Actually, it's not just a misunderstanding, but it is based on malice. I don't do everything myself. Number two, the kind of checks and balances that we have in my office are second to none, because there is nobody who starts a transaction and ends it. We make sure that it passes through several hands so that each one acts as a check on the next. And that is best practice. Now, the Assemblies can only offer effective oversight if resources are released. And again, I confirm here that I've always given the county assemblies priority. Indeed, when the county assemblies were being discriminated in terms of salary payment, it is me who came up and insisted that the executive had to bring their salary requisitions along with the county assemblies, because I felt that there was discrimination. The discrimination was not from me. Rather, I was the one protecting the county assemblies from the executives. Really? Honorable Waka, we need a session for me to update you, because what is happening here is that you have lived in the past while we have moved on, and we are now on to, more progressive things that can help the county assemblies. I want to address one other issue that came here. And the honorable member here was asking me, what is the law of public participation? Now, for those of you who are familiar, you know that there is a law. There is a bill that was taken to Parliament on what constitutes proper public participation. this law is still in progress. It has not been made into an act. So, and many people participated, they gave their input, and we believe that when it finally comes out, it will give us boundaries on what we can consider proper public participation. But as it is right now, it is still a requirement for you to show some form of participation from the people who are involved. We cannot just stop doing it because the law is not out, but I'm with you in that we need guidelines to ensure that we understand fully what constitutes proper public participation. Now, you are asking me to close my eyes to some things. Now, you have seen, even if you look at today's paper, you will see the Auditor General's reports. What is the Auditor General saying? Many spending entities have not spent the money that they were given lawfully for the intended purposes and in terms of prudence and transparency, they have failed. That is the reason we keep getting qualified audited statements. Now, I am there upstream trying to guide you, bringing you back to the rails and telling you if you go this way, the Auditor General will actually give you a disclaimer. So, I try to do the stopgapping before you meet the Auditor General. But if you think I'm being too hard, I can be soft and let you meet the Auditor General. You still will not escape. So, ladies and gentlemen, I think I'll stop my responses there in the interest of time. Thank you.
Thank you, Dr. Margaret. So to CPA Mary Wanyonyi, please.
I think the question was, I think I can start and then
that's okay.
Madam Chair can finish. And it was touching on resources follow function. And so I just wanted to inform you that the member of Assembly from Taita Taveta, that we actually, together with the stakeholders, we identified the attendant financial resources, an activity that we finished not long ago. And recently we forwarded the recommendations to CRA for implementation. So from there, I can hand over to Madam Chair, CRA.
Okay, to CPA Mary.
Thank you. I will address the issue that was raised on functions versus resources, and what would be the optimum for running a county. Now, through the fourth basis of revenue sharing, which was released in the year 2020, by 2024 December, for application for the years 2025, 26, and the next 5 years, because the revenue formula is developed and it is applied once it's adopted by Senate and, or let me say Parliament, both Senate and National Assembly, then it is used for the next 5 years. The commission, the third commission, for which I chair, we made a deliberate effort to ensure that small counties are catered for and are able to function. How did we do this? Through the formula. In the formula for revenue sharing, the fourth basis one, the commission allocated 35% for purposes of what we call the basic share. 35% of the entire allocation was for the basic share. What does the basic share address? It addresses the fact that every county has one governor one deputy governor, and the chief officers that are required to run the institution, and the county members of the assembly. So what Nairobi gets in terms of basic share is what Lamu gets in terms of basic share. So that is how we made one of the deliberate ways of ensuring small counties are covered. What was the other deliberate way? We applied the provision in the Constitution that allows us to apply the affirmative action. So through the affirmative action, when we did the formula, we made sure that small counties were an amount was set aside for small counties. Those counties deliberately got extra resources, and then whatever remained is what was shared out among the rest of the counties. So, and again, another deliberate action is to ensure that no county receives less resources than they would have received the previous year. So that is to ensure that there's continuity in the counties. The budgets that they would have prepared, they are able to continue providing services without the hindrance of lack of resources. Another area that was raised was the issue of even complying with the 35% of the wage bill. Now, through various interventions, and the key one, and the counties are aware, is the own source revenue. If counties are to raise their own source revenue, then they will be able to bridge that gap. The CRA made a study. We came up with a study that identified that if counties were to raise to their potential, and the potential of counties through the study was identified to be 216 billion. You can imagine last year's allocation. The allocation we've just recommended, we recommended 450 billion, but the counties are going to get 420 billion. So counties, you can imagine if you can raise 216 billion of your own source revenue, then that is an amount that should go towards development of providing more services to the counties and to also bridge that gap of the wage bill. I want to say that we have been making deliberate efforts to ensure that we support the counties through even the county budget economic forums. There was the issue of public participation. We facilitate those forums and capacity build them so that through the representation role, then the counties are able to interact with the citizens through the county budget economic forums that are established in the counties. So there are a lot of interventions, CPA Chair, that the Commission on Revenue Allocation is doing, and I know the county assemblies and the county executives know that there's a lot of intervention we are doing. And our passion is actually to look into the small counties so that they are also able to render services. If you compare what Lamu was getting previously and what CRA deliberately through those affirmative actions, Lamu's allocation and another 12 counties has gone up. Chair, thank you very much.
Thank you so much for the feedback. So allow me to request Mheshimiwa to give us your closing remarks, followed by Commissioner, followed by our caregiver, Teresa, followed by our professor, then PS will be the final one.
Thank you, Madam. I want to thank the Almighty God for this far that we've gotten. I want to appreciate the CAF leadership and my fellow panelists and my colleagues. I saw my speaker of Migori County Assembly plus my other MCA colleagues who are here in numbers for the moral support and being there for us. And I want to challenge each and every county assembly and with facts that the National Government Act on Childcare was enacted just months before the general election 2022. We are not time-bound. We can have the legislations passed so that the children that we really value can have a framework or an umbrella that can cover them. It's never too late. It's better that we really work on it, and it should, after this CAF session, we need to have a serious follow-up to this so that we can have these acts, and then the committees pick up very strongly so that the children can be protected. Otherwise, thank you so much, and I want to wish each and everyone well.
Thank you, Mheshimiwa Graham.
Thank you. I also want to appreciate the leadership of CAF, members of various assemblies, my colleague panelists, and of course, this was a great opportunity to share the insight about what we understand on childcare. As an institution, IGRTC, I am sure now at least you understand what we do, and if there's any issue that you'll wish to raise with us, please do so. Our doors are always open. Thank you.
Thank you. Teresa? Teresia?
Okay. On behalf of children from mothers who have no education, from those from the rural areas, from those from the lowest quantiles who may not have an opportunity like I have had today to speak to our honorable members, I feel compelled to make a call to all of you honorable members as a remembrance for the 6th Legislative Summit, to be among the first legislators who will come up with legislation on childcare, who will be able to support these women to have places where to leave their children. It is my humble submission that we are going to be champions of childcare and early childhood in your counties. Thank you, and I will continue praying for you.
Thank you, Prof. So, Madam Teresia, closing remarks.
Thank you. All I'm saying is thank you everybody for coming here today. This was a very special occasion. And mine is just to add on to the government to check on the things we talked about concerning the licensing so that our operations as provider can be safe and good kwa ground. Maana kuna shida sana. Tunatatizika sana. We really need help. Even if kama kuna mradi hivi wanaweza kutupatia tuweze kufanya ili kusaidia kwa ground kwa center zetu. We can really appreciate it. Thank you.
Thank you. So to the PS to give us remarks.
Thank you. Thank you very much. As I conclude, I just want to say that this is the moment to translate policies and laws into action so that the children of Kenya, especially 0 to 4 years, can feel what the law has for them. And we have made a declaration, as she requested, with the county, the COG team, and also with relevant partners who are willing to support, that we need now to go into implementation of the policies we have, and where there is missing policies by the county governments, there is need to urgently work and have the policies in place. I want to urge the members of County Assembly that let us go back. Childcare is a function of the county. We can work with the, you can work with us as the national government to support and establish childcare facilities. If every county established just one childcare facility in every ward, that would mean a lot for the children who are in the age of 0 to 4 years, because the counties have done a lot, and I want to commend them on ECD infrastructure. This is the time now to go back down to the age that has not been taken care of, because brain development starts from there. And if we do this, we will ensure we deal with this matter on the gap on childcare. We are ready to work with all the county governments to help them develop children policies and childcare regulatory frameworks that will ensure budgets are fully, the childcare budgets are incorporated while making the budgets. Thank you.
Thank you so much, Madam PS. Ningeomba tuwapigie makofi panelists wangu jamani. Thank you for the rich conversation. At least, as you are saying, our role is about representation, legislation, and oversight. We've seen that it has cut across from the discussions about public participation, the financing, the laws, the bylaws, and everything. So I want to say thank you so much for this. Na ningetamani kukuwa speaker kwa leo, vile anauliza, as many as of the opinion watafanya childcare kwa agenda yao, say aye. Asanteni sana. So I'll request my panelists, we take a step for a group photo, and then we hand over the program to MC. Thank you.
Panelists, I think we're going to have a group photo together. Let's close in. No, random, just the way we are. But let's have the gentleman at the side. Yeah, there you go. Asante sana. Thank you. Makofi kwa the panelists. Thank you so much for a wonderful, wonderful contribution. The general discussion. Thank you to our moderator for handling this so well. Thank you to our presenter earlier on, Professor Teresia. Thank you so much. To all the panelists, may God bless you. I know you're still going to be hanging around with us because we still have a long program. Our chief guest is in the building, ladies and gentlemen. The Sergeant at Arms, Tafadhali. I'd like to ask you to kindly request the delegates who are outside to come in so that we can begin our program officially because our chief guest is here. So the delegates who are outside, please, tafadhali, karibuni ndani. Sergeant at Arms, tafadhali, munisaidie wote waje because we should be starting in about 5 minutes or so. It's only a matter of inviting our chief guest from the holding area, but he is here together with his delegation and together with others. Asanteni sana for all those who are here. I know it's a bit warm, right? But please bear with us. We're going to run this program very quickly so that we take a break.